Hi, this is Melissa Luna with How to Lower Your Part D Drug Costs, your Medicare Minute for June 2023. Today, we will learn about programs that can help you save money on your prescription drugs. Point 1. Understand the Extra Help program and if you may be eligible. Extra Help is a federal program that helps pay for your out-of-pocket costs with Medicare prescription drug coverage. Your income and assets determine if you are eligible. The monthly income limit is around $1,800 for individuals and around $2,500 for couples. The asset limit is nearly $17,000 for individuals and around $33,000 for couples. Even if you think your income or assets are above the eligibility limits, you could still qualify for extra help because certain types of income and assets may not be counted. You automatically qualify for extra help if you have Medicaid, supplemental security income, or a Medicare savings program. Extra help can save you money in many ways. The Extra Help program pays for your Part D premium up to an amount determined by your state. It lowers the cost of your prescription drugs. If you delayed Part D enrollment and have a late enrollment penalty, Extra Help eliminates your Part D late enrollment penalty. Finally, people with Extra Help can change their Part D plans more often, if needed, such as to lower costs. Remember that Extra Help is not a replacement for Part D. It is also not a plan. It is a cost assistance program. To be eligible, you must have a Part D plan to receive Medicare prescription drug coverage. If you do not choose a plan, you will, in most cases, be automatically enrolled in one. Point 2. Learn if your state has a state pharmaceutical assistance program. The Aging and Disability Resource Center offers a prescription drug assistance programs, which are called PDPs for short. PDPs help state residents connect with pharmaceutical companies, patient assistance programs, which help lower or eliminate drug costs. But each program works differently. To learn if you may be able to get assistance from PDA with your drug cost, call the ADRC at 1-800-432-2080. Point 3. Use other strategies and programs to save on drug costs. Whether or not you qualify for Extra Help or a PDP, you may have other options to help save on drug costs. If you are struggling to pay for expensive brand name medications, you may want to speak to your doctor about whether you can use a less expensive generic drug. You can also speak to your doctor about getting samples of your medication if you are temporarily having trouble accessing it. You may try speaking to your pharmacist about waiving your copay. Although pharmacists cannot routinely waive copays for people without Extra Help, your pharmacist may waive your copay on a case-by-case basis. If you are getting a drug from a hospital pharmacy, you may also be able to ask if the hospital has a charity care program that would allow you to access the drug at a lower cost. You may be able to get medications at a reduced price for national or local discount programs, which you can find on needymeds.org or goodrx.com. Point number 4. Be aware of pharmacy and prescription drug fraud. Just as it's important to get assistance with your drug costs, it's also important to protect yourself from potential fraud, errors, and abuse. There are many types of prescription drug schemes. A common pharmacy and prescription drug fraud scheme could be when Medicare is billed for a medication that you did not receive. Another type of scheme could occur if you are given a different prescription than what you were prescribed. It's so important to read your Medicare statements to check for errors or suspicious charges. This would include checking your statements to ensure that the medications you pick up from the pharmacy are the type and quantity of medication you were prescribed. If you notice anything suspicious with your Medicare statements or medications, contact your local Senior Medicare Patrol, or SMP for short. Your SMP can help report the incident to the correct authorities. Take action. If you think you qualify for extra help, you can apply through the Social Security Administration or go to www.ssa.gov or calling them at 1-800-772-1213. And a final option would be to visit your local branch. You may also call your state health insurance assistance program, also known as SHIP, if you need help applying for extra help. They can also explain whether your state has a PDP and how to apply. Speak with your doctor and pharmacist about other potential ways to lower your drug costs. For assistance with any Medicare issues, call our local New Mexico SHIP at 1-800-432-2080. Thank you for joining me for this update on Medicare enrollment period, and please look for additional minutes for the months to come.